Hello, everyone. On March 25th, the First Parish Church in Arlington Center will be the site for a legislative forum, the topic of which is criminal justice reform. In advance of that and in anticipation of that event, we are having a series of conversations with different constituencies and folks in Arlington who would know about different aspects of criminal justice reform. I'm joined today at Arlington's police station by our Chief of Police, Frederick Ryan, and we are going to be talking, the topic for today is going to be restorative justice and the culture of the Arlington Police Department around issues of criminal justice reform. So as always, it is a pleasure to talk to you. Appreciate your being here, or welcoming us, as always.
Thank you. Thank you for having me.
And looking forward to the conversation. So as I mentioned, the topic I'd like to talk mostly about is the concept of restorative justice. Can you give us a little background about, what that means within the context of the Arlington Police Department?
Sure. So restorative justice programs and concepts are about addressing the harm caused typically through a criminal act. And it's one of our pre-arrest diversion alternatives that we have here in Arlington through our partnerships with the Communities for Restorative Justice. We are a member of, which is a multi-jurisdictional consortium, private nonprofit that sort of oversees and administers the criminal justice, restorative justice process for its members, including Arlington. We also have a pre-arrest diversion program for juvenile drug and alcohol offenders, and that's been, and a lot of times people ask, why two pre-arrest diversion programs? Generally speaking, restorative justice works well when there's a victim. And for so-called victimless crimes, such as minor possession of alcohol or minor amounts of drugs, we use a diversion program that has a substance abuse assessment to it and other elements to get these kids back on the right track, making responsible decisions moving forward. But a lot of folks say, "What is restorative justice?" And it's a difficult concept to easily explain. But here's how I sort of sum it up. I try to do a compare and contrast to the traditional criminal justice system. And in the traditional criminal justice system, we ask, was there a crime, who did it, and what's the penalty? And the victim in that process is but a witness in the Commonwealth's case. They have very little control. It's the Commonwealth that drives the bus. Contrasting that with restorative justice, in the restorative setting, we ask, was there harm? Who was impacted by the harm? And most importantly, how do we repair that harm? How do we get back to the baseline from before the criminal act occurred? And it's a concept that is difficult to understand. And I admit, when I first started learning about this, I was a little, as a typical cop, a little uneasy about it until I sat in a circle. And it is absolutely amazing to watch this restorative circle unfold and see a victim have a conversation in a controlled environment with an offender about how the crime impacted them, what the harm was, and then to hear the offender have to explain their actions to the victim in that controlled environment, and then as a group decide how are we going to repair this harm. Fascinating process. A contract is developed as a result of that opening circle conversation, and then typically about 3 months later, the circle reconvenes in what's known as a closing circle to sort of evaluate how the offender did at repairing the harm. If they've repaired the harm to the satisfaction of the victim and those participating in the circle, then the case is closed.
If I can ask you just to elaborate a little bit more, who are the people who are participating in the circle? You've mentioned that the victim is there, the perpetrator is there.
Right.
You were present. I assume there's probably a healthcare professional or a therapeutic professional there.
Yeah, it depends on the facts of the case, but almost all cases have, all cases do have the offender and the victim. They are also represented by a volunteer who works with them in advance to prepare them for the circle, so that it's a sophisticated process. We just don't jump into a room. There's planning that goes into it and education that goes into it, both for the offender, so that they're not walking into a sort of a gotcha environment. We want to make sure they understand this. It's not what it's about. It's about repairing the harm. And then the victim understands what their role in the process is before we go into the room. Then there's typically a police representative, a facilitator who facilitates the process and controls the environment. And then depending on the nature of the crime, there may be others present who are impacted by the crime. But that's generally who's in the room during the process.
Okay, so it sounds to me like that is it's a great idea. And I can imagine that it would work well as an alternative to other forms of prosecuting crimes and offenders. How long has it been that you have adopted this approach, and have you seen? Has it been long enough, basically, for you to be able to talk about outcomes, whether they reflect, in fact, positive results or not?
Yeah, so the Communities for Restorative Justice has done some data analysis on all the cases that have been diverted through C4RJ, and the recidivism rate in a restorative setting, and I don't have the data off the top of my head, is substantially lower than the traditional criminal justice process. But more importantly, victims feel empowered, restored, and perpetrators oftentimes feel a renewed sense of community, and the community is investing in their success rather than their failure. That's what this is about. We're too quick to give people scarlet letters and give them a Corey record and wave our finger at them and say, shame on you. And we almost set people up for failure. And when we look at criminalizing juvenile conduct, when I was a teenager, my very existence was disorderly, and we make that criminal, and there's a lot of research around the juvenile brain, and particularly young men don't mature until they're well into their 20s, and we're criminalizing juvenile behavior rather than putting these minor crimes into a restorative setting and helping people learn about their unlawful behavior and the consequences of it, and then getting them back on the right track.
So, because the overall topic here is criminal justice reform, and because I think it's hopefully quite clear to one and all what the benefits of the restorative justice program you were just describing, what benefits there are for the victims, who have traditionally been not part of the process or not had their own needs addressed. Without minimizing that, I want to put that aside just for a second and focus again on the offender, and ask you what happened. So in the traditional process, an offender would be arrested and charges brought, and perhaps there would be a trial, and he or she would be adjudicated, and then they'd be sentenced, et cetera, et cetera. What happens in this diversion program with the offender? Are the outcomes, not just in terms of recidivism, but is what he or she is facing palpably different from what happens under the traditional system? Yeah,
for most offenses, the reality is it's more difficult to go through the restorative process because it requires some reflection, and you got to dig deep around your own conduct and your own actions, and then repair the harm that you've caused. The traditional criminal justice system, if we take a lot of these crimes that we put into restorative justice, minor malicious destruction cases and property damage and stuff like that, the reality is you walk down to the courthouse, you You pay a $45 victim witness fee, you go through the revolving door at the courthouse, the case is dismissed, and the process almost reinforces bad behavior because the consequences are almost none. And you never have to look at the victim that you've harmed because the process doesn't, in fact, the process prohibits that. And so this turns it on its head, and an offender has to own it and dig deep and write a reflective letter about their conduct. And you know, a lot of times, you know, some of these crimes we've seen has resulted, you know, from a person's really ignorance as to the consequences of their behavior. And then when they're enlightened by the fact that, no, their behavior has had consequences and harmed people, it helps them learn and process in a supportive setting. It's not, again, I can't emphasize enough, it's a setting that is structured, very formal, but supportive of not only the victim, but the offender. The offender is we're invested in their success and not their failure. And we find that when we invest in an offender's success, that it is an incredibly enlightening and empowering experience for them. And you know, I could give example after example of where offenders have come out at the other end of the process feeling more a part of the community and wanting to engage. And that's a win-win every day of the week. Concord had the flagship case. A kid damaged the mom and pop 5 and dime, and the owner of the mom and pop was furious with the kid because he had to shut down for a day and have windows repaired and graffiti and all this stuff. And the police caught the kid, and the police chief, who was friendly with the owner, this was like 15, 17 years ago, went to him and said, "We'd like you to try this restorative justice thing." And the guy was like, "Hey, I want that kid to go to court." And the chief had a relationship with the guy. He said, "Come on, do me a favor. I just want, you know, please try it." Well, they did it, and the opening circle opened up, and of course the chief saying, "This thing's going to go south. You know, this thing's going to be real bad. This guy's going to reach over and he took out money. He said, you know, I'm a mom and pop operation, and this cost me real dollars, and I had to close, and you don't understand." And they settled him down, and they, you know, did the opening circle. Anyways, at the end of the process, the kid wound up working at the 5 and dime every summer all the way through college. The families remained friends.
Wow.
Now, that kid could have had a felony Corey record,
Right.
which, you know, he was a kid, right? And now, yeah, I mean, that's what we're trying to achieve right there. That's really sort of sums it up. Rather than have two enemies and a kid with a scarlet letter, and, you know, now we have friends, and you know, the kid had to work and pay for the damage, and you know, I mean, he was held fully accountable, but he wound up working there the rest of his summers. Yeah.
Yeah, so I think I may need to stand corrected in that the scenario that I unwound as part of my previous question may not be the the analog or what would happen if somebody took a different path, because it sounds to me like you're describing that offenses that would qualify for this diversion would be, you know, of a scope, a relatively minor scope. Such that the alternative might be, as you just described, going and paying a fee and never really having to face what it is that you're doing.
Right. And it's important, you know, and I probably should have pointed this out at the front end, but it's important to understand there are some people, some violent people that need to go to jail and that need to be prosecuted. I mean, we understand that. But the overwhelming majority of our work is with people who have committed relatively minor offenses, and where there's an opportunity for the community, not the police department, but for the community to embrace the restorative concepts and invest in the success of our youth, typically our youthful offenders, to ensure that they move on and mature into adulthood and become productive members of our society. We have a number of examples of where that's worked, and they don't have a Corey record following them around the rest of their lives.
How common or uncommon, and again, I know that I'm asking you, I understand that you can give me all the answers that I need, or us all the answers we need regarding the Arlington Police Department, and I'm asking you now to either speculate or just use your informed judgment to answer this question and perhaps others, and that is, how common are these diversion programs within other police departments in Massachusetts, and then beyond. And again, I guess on a national level, is this I hate to belittle it by calling it a trend, but is this a way that police departments are moving across the country, as far as you understand?
Yeah.
Or
Well, in Europe, restorative justice is used widely, and used widely with very serious offenses. In the U.S., to answer your question, are there other diversion models out there? Yes. Most of them are the pre-arrest diversion, pre-arrest juvenile diversion type of program, like I discussed with drugs and alcohol, that we also have here in Arlington. Restorative justice, unfortunately, is in Massachusetts pretty much just those member agencies of the Communities for Restorative Justice, which are Arlington, Lexington, Bedford, Concord, Acton, Stowe. Out in the sort of the central Middlesex region, there's about 14. Burlington has recently joined. Newton has recently joined. So it's growing, but it's not mainstream. And again, these are, they're difficult concepts to communicate to, traditional cops. I was resistant to it until I sat in that circle. And we do train our officers. There's a video that we show of a restorative circle, and it takes time for it to become a part of the fabric of the organization. I'm feeling like in Arlington, with the support of the community, the First Parish Church has been incredibly supportive of restorative justice. Reverend Marta Flanagan spoke at our annual meeting for the Communities for Restorative Justice, did an amazing job. So we're feeling like it's become a part of the fabric, and that's so incredibly important to be able to deliver more sophisticated and smart policing services, as far as I'm concerned.
And you did cite that, this can be a tough argument to make, at least initially, to people who, what you referred to, traditional cops. Well, my understanding of the indoctrination to the force, in a sense, the traditional one would be to perceive of yourselves as warriors, as defenders of the safety of the populace, et cetera. And my sense is that in Arlington and many other communities, perhaps, that there's been a shift to have officers see themselves more as guardians of the community. Can you talk about that a little bit?
Yeah, great. So we used to take officers out of the police academy, so they go through 6 months of paramilitary training, and then we put them into a 90-day in-house, what we called a field training officers program, FTO program. And as we looked at that program and sort of evaluated it, what we realized was that we were training Joe Fridays. We're training them incredibly well at all the tactical and appropriate officer safety, which is important stuff. But we weren't training on, how to go out and talk to people and establish meaningful partnerships and relationships in the community. So we scrapped that program, and we sent 6 of our officers down to the Southern Police Institute down south, and we developed what's known as a PTO program, Police Training Officers Program, which is heavily weighted on learning our philosophy of policing in Arlington. And as a central part of that is the whole concept of guardian versus warrior. And unfortunately, in our complex society, there are times, very rare, but there are times where we need our officers to become warriors. And it's important to do that training, and it's important to have that skill set and to have the tools to be able to do it. But we have to recognize that that's a fraction of our work. And so once we've satisfied those training needs and got the tools needed and the confidence in our officers to be able to, God forbid, go into an active shooter situation or some other event, we then refocus on, now this is a day-to-day function of an Arlington police officer, and that is as a guardian and a problem solver and a member of the community not driving around with the windows up and not engaging our community, but seeking every opportunity we can to have conversations, learn about problems in neighborhoods, help solve. What we say is, so I don't know if you saw the photo contest, the national photo contest, where one of our officers won a national award. Yeah. And that really is a function of a mindset, and the mindset in our training and our in-house policy is, if you get dispatched to a call and there's a problem, own it. Own the problem and fix it.
And just to clarify for our audience who may not have seen that photo, as I recall, and please correct me, it's that the Arlington police officer is helping an elderly resident, I believe, with her phone, or?
So she had been very generously gifted a smartphone by her family so that they could communicate with her to check in on her and ensure her safety. And she wasn't skilled at using it, as many seniors have difficulty with this new technology. And so the officer took the time to say, well, listen, I'm going to program in your favorite list with the names of your loved ones, and you just have to tap the button. And so the officer did the data entry and a little bit of training with the woman, contacted her family out of state, and it was really a nice story. But it illustrates so much more. It illustrates the culture of a police department that, unfortunately, in many jurisdictions, it would have been, are you okay? Yeah, okay, call your daughter in New Jersey, I'm out of here. But this officer took the time to let this woman know that we cared about her, helped her understand the technology, and it won a national contest. We're very proud of the work of that was Justice Scarborough, one of our great patrol officers.
And you mentioned the culture of the police department, and another aspect of this particular culture, which you've touched on almost everything you've said already, is a program for which Arlington has been recognized well beyond the bounds, not only of the town, but of the state. I know you were in Washington, D.C. not that long ago, being asked to speak on this program, and that has to do with the APD's approach to the opiate epidemic that is both statewide and national in scope. Can you talk a little bit about that program?
Sure. Yeah. So,
and give us an update as well.
Yeah, right. So just, again, by way of background, we were wrestling like every other jurisdiction in America with opiate overdoses. And we realized as we began to look at the data that we had a situation of, we didn't know what we knew. And that was, we had a whole list of names in our database of people that had previously overdosed. And we're highly likely to the data is pretty clear. If those that previously overdosed
they're at
are high risk of overdosing fatally. And so it was one of those aha moments where we looked at it and said, we know who our next fatal overdoses will be. We have it in our database. And the question became, what are we doing to do some intervention planning and to try to prevent these deaths? And so from that conversation was born the Arlington Outreach Initiative, where we do outreach to those suffering from substance disorders and work with they and their families. And we apply very simple concepts. I know this has gotten national attention, but the reality is they're very simple concepts that we apply. So when we get to the patient and their family, we apply the same concept we do with a domestic violence situation. There are many women in abusive relationships who, for valid reasons, decide not to leave their batterer. And in years past, we used to stigmatize those women. Why isn't she leaving that guy? That's crazy. We've evolved from that, and we recognize that there are a lot of valid reasons why women don't leave abusive relationships. So we work with a safety plan to make sure that if they're at high risk, we plan for the next assault to ensure their survival. We put a plan into place for when they are ready to leave that abusive relationship so that we can empower them to move on and onto their safety. Same concept with somebody who's suffering from a substance disorder. There are many valid reasons why they're not ready to get help today, but someday they will. So let's put a plan in place. If your loved one is expecting a child, you have a plan, right? You know who the doctor is, you know who the healthcare provider is, you know the medical insurance, you know how you're going to drive the car to the hospital, you have a bag packed. There's a plan. Apply that same concept to your loved one with a substance disorder. Put a plan in place for when they hit that moment, that very narrow window of opportunity when they seek help, that we can hit the button and get them the help that they need. And we've found that that's had overwhelming success at driving down the stigma associated with addiction and saving lives. Calendar 17, I just went over the data yesterday. We will conclude the first 2 months of the calendar year with 0 overdose fatals. That hasn't occurred in the last 3 calendar years. I'm hoping that's a glimpse into the future for 2017. Our goal is to have 0.
It's always great to have things that are hopeful to share with us. That's wonderful. I wanted to just finish up the conversation by again refocusing on it's criminal justice reform that we're referring to, and so lots of times when police are brought into onto the scene somewhere, the person who has precipitated or done the behavior that brings you there, there's at least 2 possibilities. There's probably many more, but I want to focus on just 2. One is that person's actually engaged in criminal activity and needs to be dealt with accordingly. Another is that there are mental health issues or aspects. Those may be related, but that officer has to decide, I guess, relatively early on, which way that's going to go. And that then plays into how things happen from there. With that in mind, I know that the Arlington Police Department employs a mental health clinician on staff. Why is that helpful for the way the department functions?
Yeah, so several years ago, we do a lot of data analysis. We try to be a data-driven law enforcement agency and try to make more intelligent decisions around deploying our valuable resources. And we recognize that a large percentage of our calls for service had a mental health component to them. And when we equip our officers with tools, if you only give them a hammer, everything's a nail. And so what we're finding was, in situations where somebody in crisis may have committed a minor criminal offense, the officers were using their handcuffs because it's the only thing we were giving them. And we were charging people with really frivolous misdemeanor crimes because the officer had to take somebody who was in crisis and put an end to it. And so that was when we looked into, and we were one of the original departments in the Commonwealth to get DMH funding. Senator Donnelly's office was very helpful with us at getting funding for a clinician embedded into the police department in what's known as a co-responder model. And so our clinician co-responds with police officers, and once a situation is stabilized, she brings a whole other set of tools to the situation. And so that we're now, rather than putting people in a jail cell for minor criminal offenses, we are diverting them to the healthcare system and working with they and their treating physicians on getting them the help that they need and out of the crisis that they're in. And our arrests have gone down, and frankly, so has our crime rate. 2016, our Part 1 crimes were down 19% in Arlington, and our arrests are down. So as far, if we can continue to drive down crime while driving down arrests, that's sort of the pinnacle for municipal law enforcement to be able to achieve that, and we strive for that.
So I'll ask you again, in light of that, how common is it for police departments to employ these tactics and also this kind of, do this kind of staffing?
Yeah, it was uncommon at the front end. And frankly, when we implemented this program, I was concerned about it. I expected pushback from the police officers. And I'm proud to say there was very little pushback in our organization. And, when I hear on the radio, when I hear an officer say, is the clinician available? Can you send her to this scene? I just get this overwhelming sense of satisfaction that we are handling people in a far more sympathetic and dignified way when they're in crisis, as opposed to slapping them in handcuffs and throwing them in a jail cell.
And it does seem like within your department, and we're lucky to live in a town in which this is the case, you all are marching to the beat of the same drummer, and that, as you said, you might expect pushback and be pleasantly surprised to get instead people signing right on. That ties into we've talked before about the fact that on the national scope, there remains a lot of tension and concern about police relations with their communities. Does that have any effect on your own department? And if so, how is that larger, like that macro scale situation, how is that, for want of a better term, viewed?
Yeah, it does have an effect, right? Police, we hire from the human race, and we come to the job with our own flaws and biases, and so when the storyline on the 6 o'clock news is anti-police, you begin to internalize that and wonder about your own profession and career choice. But we also have in Arlington a really unique leadership development program. We've invested a lot of time and energy in a leadership development program whereby we invest in the leadership skills of employees at all levels and ranks, sworn and non-sworn. And the concept there is we expect leadership at every level of the organization. From our parking control officers who deal with challenges in the field on up to the chief of police, we expect people to embrace these challenges in a professional way and overcome them, exercising leadership. And we've done a lot of training, a lot of policy work on it. We have a leadership framework that identifies how you get the leadership skills you need. I would argue that Jessica Scarborough, when she was out there solving that problem, was exercising leadership. She was embracing the problem and dealing with it. So my point is given that we've invested in a culture of leadership, our officers are able to overcome sort of the constant negative, drip, drip, drip of anti-police media and recognize that we're blessed to work in an incredible community that supports its police, not only supports its police, partners with its police to help address issues in the community. And we're just blessed. I'm blessed as a chief of police to have professionals at every level of the organization who treat people the way they ought to be treated, and a community that supports me in our community policing philosophy. It's and as you know, I considered leaving, and this is part of what the thought process that I went through when I had that job offer was, this is among the best communities in the nation to serve, and also I'm extraordinarily grateful to be able to serve my hometown as chief of police. So we're in a good place in Arlington, and it's because of the community and the support we get from the community.
Granted that is the case, and I'm the last person to argue about that at this point. But I'm wondering, is there anything that the community and/or the police department can actually do better, and that you feel is the next challenge that needs to be tackled, either on the part of the community or the APD or both?
Yeah, we're wrestling with this whole Sanctuary Trust Act issue, and I although I was out of town, I was briefed up on the meeting at Town Hall on Monday evening.
Meeting, yep.
And the civil discourse that occurred, there was no yelling and shouting and finger pointing and name calling. It was a conversation about a complex issue. And I think that speaks so well of our community, that we can have these difficult conversations, make some policy decisions moving forward, and let the chips fall where they may. To answer your question, continue to hold the police department accountable. I know full well that I work for a board of selectmen and a town manager, and we have a human rights commission that wouldn't accept police performance that was heavy-handed or in violation of people's civil rights, and it's important that we always keep that pressure on. You know, our commitment to fair and impartial policing is among our highest priorities, and keep the pressure on, because we don't want to lose, take our eye off the ball.
Well, as always, a pleasure to talk to you. Thank you
Thank you
very much for taking the time.
Thank you for having me.
Chief Ryan mentioned the value of public discourse, and I just want to close by reminding you that an excellent upcoming opportunity will be the Legislative Forum on Criminal Justice Reform that will be held on March 25th at the First Parish Church. You can find out all the information you need to know, including registering for the event, by going to the website on your screen. Thanks for joining us. I want to thank Chief Ryan again for a very elucidating conversation as always, and we hope to see you on March 25th and keep the conversation going. I'm James Milan.